distinguished expert, Dr. Abhishek Kotwal. Dr. Abhishek is a highly regarded interventional neuroradiologist with over 10 years of experience. Dr. Abhishek's academic achievements are remarkable, from completing his MD and DMB in radiodiagnosis to earning a DM in neuroimaging and interventional radiology from NIMHANS. He has consistently excelled in this field. Additionally, his fellowship in neuro and vascular intervention has equipped him to handle some of the most complex cases with precision and empathy. So thank you for joining us, doctor, and it is an honor to have you with us today.
Thank you for kind introduction.
So now, doctor, let's dive straight in. So biodegradable stents are gaining attention in the field of neuro-interventional neurology. So can you start by explaining the mechanisms behind these stents and how do they differ from traditional metallic stents?
Okay, so biodegradable stents are basically advanced generational stents. So if we divide them by generations, so first generation were drug eluting stents only, and slowly in second generation, some polymers were coated around the stent apart from the drug, and in third generation we are having biodegradable coated stents. They are drug eluting also, and they are having biodegradable coating also. And in next latest stage, only they are made up of the polymer free drugs. Okay, so they will disappear in the body after some time. So advantage is basically whenever we put a stent is basically a foreign body. So our body acts in the form of formation of thrombus or some foreign body reaction will happen. So basically these stents they'll absorb in the body. So after some time the thing will remain inside. So we don't have to give antiplatelets for the long time, and they will disappear within the wall of the vessel. So nothing extra will be there inside the vessel. So obviously we'll be having less chances of restenosis, less chances, less and less lead of the what we say antiplatelet drugs. So in this way they are much better.
Yes, I think that is really insightful and enlightening, and I think it is so fascinating to see how actually these stents work so differently compared to the metallic stents also. So now, building on that only, doctor, what are the key advantages of biodegradable stents, if you could explain in detail in the treatment of neurovascular diseases especially, and specifically how do they contribute to long-term patient outcomes?
Yeah, so in neuro, they are actually a recent thing. They are being used in cardiology since very long time, since I think 1 decade. But in neurology, they are now recent thing only, and at very few places they are being used. And that too in older generation, first or second generation stents are mostly used, and newest generation stents are still in the trial phase. So advantage is like firstly they'll be coated with the drug, so they'll eliminate the proliferation of endothelium, excessive proliferation, which leads to later on restenosis of the stent. So this phenomena is blocked by this kind of drug eluting stents, and also they'll decrease the neointimal growth. So that's why they reduce having possibility of in-stent restenosis and excessive thrombus and excessive endothelial proliferation around the stent. And they'll be having different kinds of struts. So basically older generation they were having longer stents. Now newer generations they are having thin struts. So thin struts also they will having advantage in the form of reduced platelet activation and reduced footprints. So all these are advantages.
Yes, I think those are truly remarkable. And now coming to some drug eluting stents, so could you elaborate on the types of drugs typically used in these stents for neurovascular diseases, and how do these drugs specifically target issues like thrombosis or restenosis in the brain vascularate?
Yeah, so it depends on the again generation of the stents. So first generation stents, Cypher stent or Texas stent, they are having mostly sirolimus or paclitaxel coating with them. However, newer generation like Resolutonics and other stent, newest generation is biofreedom stent. So they are having biolimus coating with them. biolibus, evorolibus, jotarolibus. So this coating is also getting improved, and so slowly we are switching from the basic serolibus to the biolibus, which is having less chances of the hypersensitivity reaction and the better effects.
Yes, I think that is something excellent, and I think your explanation is also really interesting, incredible, doctor. So now, while these technology hold tremendous promise, so there also must be unique challenges with it. So, are there any specific complications or risks associated with biodegradable or drug-eluting stents that clinicians should be particularly mindful of?
Yeah, obviously. So this is also a new thing, and that's why some but disadvantage are there. That's why they are in the trial phase. So possible disadvantage can include first, they are drug coated, so obviously they are having side effects of drug in the form of as we are blocking the excessive endothelialization, so it can hamper with the normal endothelialization also. So endothelialization will be hampered. Second thing is drug may have phenomena of hypersensitivity, cytotoxic effects will be there. Okay, so other thing is we are going, as I told, we are going to the thin esters. So thin esters, they are having their own disadvantages in the form of reduced radial force, reduced opening of the stent, reduced opposition of the stent with the vessel wall. So these are the possible challenges, and that's why they are still in the trial phase. Hypersensitive reaction, impaired endothelialization, and reduced radial force. These are three, I think they are the most disadvantages with these systems.
So, do you think in the coming years these challenges can be overcome?
Yeah, that's why. So, as I told previously, sirolimus and paclitaxel were used. Now, biolimus is there. So, it is having less hypersensitivity reaction and less impairment of the normal endothelialization, and more it will be dedicated to reduce hyper endothelialization effects. Hence, it will block the restenosis but will not hamper the normal endothelialization. And also, with the newer generation of some metal, especially with alloy metals of platinum or cobalt, radial force is also improved, and that's why opposition of the vessel wall is also improved with newer generations.
Thank you for shedding light on it. And I think it is so
Yeah,
important to understand both the benefits and the potential risks also
correct.
to ensure the best outcomes. So now, Doctor, lastly, for clinicians who are just beginning to incorporate these advanced stents into their practice, what are the key recommendations or tips you would like to offer regarding patient selection, stent implantation techniques, and post-procedural care?
Yeah, so I think these are under trial phases only. Especially, we have to select the patients who are at the high risk of what we can say restent again thrombosis of the stent, where we cannot give antiplatelets for the long time. They are having some kinds of contraindication to antiplatelets. So those are, I think, target population for time being. As soon as we'll get more trial results, we can extrapolate on the majority of the population.
Yes, I think that is fantastic
Yeah.
advice, and your insights will surely guide many clinicians in adopting
Yeah.
these new innovations as well, Doctor. So, as we wrap up today's session, Doctor, thank you so much for such an engaging and informative
Thank you.
discussion.